I'm Laura.
Chandler.
Marlene.
Anai. The second.
No.
Give it away.
Alright, so for the anatomy of the maxillary canines, the universal number system for this is number 6 and 11. These teeth also erupt at ages 11 to 12 years old. This tooth has the longest root in the whole mouth. The cusps of this tooth are labally inclined, and this tooth also has a more yellow appearance than any other tooth in the mouth. The canine also has a pronounced lingual ridge, and the maxillary canines has the two largest brazier spaces in the mouth. For the mandibular canines, the universal numbers are number 22 and 27. This tooth has the second longest bone in the mouth. The mandibular canines erupt before the maxillary from ages 9 to 10. This tooth is most likely to have a bifurcated root, and the cusp is lingually inclined. On this tooth, the cingulum is also less prominent, and the only root in the mouth with a mesial inclination instead of distal. And this tooth is longer and narrower than the maxillary canine. For the primary canines, the universal letters for the maxillary canines are C and H, and this tooth erupts between 16 and 22 months. This is the seventh tooth to erupt in the mouth. And the primate space tends to occur more on the mesial than on the distal. The maxillary canine also has the longest roots even in the primary dentition. A unique feature for the maxillary canine is that the mesial cusp ridge is longer than the distal cusp ridge, and this tooth also has a centered cingulum. For the mandibular canine, the universal letters are R and L. This tooth erupts after the maxillary canines, between 17 and 23 months. This is the 8th tooth to erupt. And the primate space occurs on the distal rather than the mesial. For the mandibular canines, the roots are shorter, tapered, and pointed. And the mesial cusp is shorter than the distal cusp ridge. And the canine also has a distally centered cingulum.
Okay, next we're going to talk about canine protected articulation. So what is it? WDA defines canine protected articulation as the desired occlusal relationship. Canine protected articulation is when the vertical overlap of I stopped breathing for a second. Overlap of maxillary and mandibular teeth induce disto-occlusion. Disto-occlusion is described as when the separation of opposing posterior teeth during eccentric movements. And then canine guidance role in chewing. Canines overlap during chewing, which inclines food to posterior teeth cusp, guiding to posterior teeth, where it is met with saliva to help further chew food. Canines help the mandible to be guided into maximal intercuspation of food during chewing. Intercuspation is locking of cusp of opposing teeth when they are in occlusion. And then, why is canine protected occlusion important to maintain a healthy smile? Many dentists consider canine protected occlusion to be a desirable or healthy relationship to have. One study of 500 persons indicated that there was a lesser tendency toward bruxism with canine protected occlusion. Another study found posterior tooth mobility to be higher in dentitions with canine protected. Oh my God. Hold on. With canine protection than those with group function. And group function is defined as distributing biting forces across a group of teeth rather than solely relying on canines for guidance.
Okay. So by now we learned a lot of anomalies. I'm just going to go through some. Different types of canine anomalies usually occur to disturbances during development and eruption. So some of that canines experience is ectopic eruption, transmigration, transposition, agenesis, and impaction. So this is a picture of transmigration. Can you guys see what looks funny?
Oh my.
So that one. Transmigration is a phenomenon of movement when a tooth goes across the midline, so it's out of position. It's relatively rare. The etiology, so the displacement of dental lamina to an abnormal position in an early life may result in abnormal eruptive path. And the dental lamina is created at 6 weeks at birth. I think when you're in the womb still, I wrote that one. It's a band of epithelial tissue. Other factors that can cause transmigration is the conical shape of the canine, missing lateral incisors, cystic lesions, premature loss or over-retained primary teeth, and some pathological conditions can result in the diversion of canines from the line of eruption. So this is transposition. Can you guys see which canines are transposition? So this is the lateral and the canine on the mandibular, and this is the premolar, first premolar on the maxillary. So it's an anomaly of tooth position, the most frequent, which involves the canine and the first premolar. The most suitable treatment depends on occlusion, dental crowding, aesthetics, position of radicular apices, and specific needs of the patient. So causes of tooth transposition are thought to include inversion of the tooth buds during development, alteration of tooth eruption, the presence of primary teeth beyond the maximum limits, and dental trauma. There's also evidence that exists for genetic factors to cause transposition, including increased prevalence of transposition in females on the left side, so we're screwed, and in patients with hypodontia or Down syndrome, which I love to work with them, they're so fun. Agenesis, which is missing teeth. So can you spot which area in the mouth has a missing canine? Yep, right there. So the premolar is filling in that space, and this is treated with ortho to close the gap, and often they'll shave off that enamel and make it look like the tooth. So tooth agenesis is a condition where one or more permanent teeth are missing due to failure in early tooth development. And congenital absence of maxillary permanent canines is an extremely rare condition. It may appear as part of a syndrome or not part of a syndrome. Etiology this one has a debate of why it's caused. It's claimed that congenital absence of teeth is a heritable and not been passed down to generation, which I think we've heard in another presentation. The other evidence suggests that there is multiple factors of hypodontia, like environmental with genetics.
So, disturbances of eruption. Disturbance of eruption is known as conditions or events that disrupt the normal timeline, sequence, patterns of tooth eruption. So you kind of touch base on the anomalies, and this kind of coincides with it. But Anna and I are going to focus on ectopic teeth and impacted teeth, specifically the maxillary canine. So ectopic teeth are teeth that erupt in an abnormal position outside of the typical alignment in the dental arch. Impacted occurs when the tooth fails to emerge properly and remains trapped beneath the gum line. So as I just said, they're outcomes from disturbances of eruption, but they can also be the causes, which we'll get a little bit more into later. But regardless, both conditions can impact dental health and alignment, making it important to monitor and address as needed.
Okay, so the maxillary canine ectopic eruption. An ectopic maxillary canine is a canine tooth that follows unusual eruption path in the upper jaw. Canines are the last adult teeth to emerge. They may erupt incorrectly if there is insufficient space in the jaw. Ectopic buccally erupted maxillary canines are one of the most frequently encountered conditions in ortho practice.
maxillary impacted canines. Canines that do not erupt properly from being trapped or blocked by other teeth, bone, or soft tissue. Usually associated with an ectopic path of eruptions. That was kind of what I was talking about earlier. So if your primary dentition has an ectopic tooth, when your permanent dentition comes in, it kind of follows along that eruption path, which could lead for it to be stuck up there and infected. Maxillary impacted canines occur in approximately 1 to 2% of the population. This condition is more commonly seen in the maxillary canines than mandibular, but the maxillary primary canine is one of the most frequently impacted teeth after the third molar.
So, systemic and local etiologies of ectopic and impacted canines. For ectopic canines, there is no single etiology that explains the occurrence of the majority of ectopic eruptions or a way to differentiate those occurring labial or palatal.
For impacted canines, a cause could be, like I had just said, the ectopic position of the tooth gum within the alveolar bone. So if the gum is ectopically positioned, it can lead to improper eruption, resulting in an impacted canine by preventing the tooth from following its natural path of eruption. But the common etiologies that coexist between ectopic and impacted are environmental factors, which may contribute to the anomaly during the eruption path of the canine. I don't know if Carrie's still here. She was asking about that earlier for her and her brother and the canines. Genetic factors can play a role with family history of impacted and ectopic canines, increasing the likelihood. Another possible explanation is that a disturbance associated with a follicle in the unerupted tooth may influence the direction of eruption and contribute to the displacement of the maxillary canine.
So, more factors that can cause ectopic and impacted canines are lack of space in the jaw, trauma, mechanical interference, cysts or tumors in the eruption path, over-retained baby canines, displacement of the dental lamina early in life, conical teeth or missing teeth, abnormal path of eruption from lack of guidance, obstructions along the eruption path.
Complications that can occur between the two include a risk of cyst formation around the tooth, damage to adjacent teeth or roots, so root reabsorption. So like if the canine is stuck, it could almost put pressure if it's in contact with its adjacent tooth, which will reabsorb that tooth. Potential risk factors for infections or gum disease, impairs mastication function, and physical appearance.
Some diagnosis, so early detection and interceptive treatment of an ectopic and impacted canine is crucial. And early diagnosis helps normalize the eruption pathway of displaced canines with panoramic radiographs and CBCT, which is a 3D scans, being the best diagnostic tool.
Treatment options. So for ectopic canines, in many cases ectopic canines can resolve on their own. However, if not addressed, they may cause damage to nearby teeth or bone. Specifically for impacted canines, which depends on the severity of the impaction and the age of the patient. In some cases, no treatment may be necessary if the impacted tooth is not causing any problems or discomfort. If treatment is needed, it's usually a two-step process, beginning with oral surgery, which would expose the canine, and then it would follow suit with orthodontics. So between the both, though, both can include extraction. Those are just in severe cases. Surgical exposure, which is typically the first step out of the two-step process. The gold chain method, which is also what Carrie was kind of talking about earlier. So essentially they attach a chain from the wire of your normal braces and just shorten that chain over time to get it into a line with the rest of the teeth. Or just your standard orthodontic treatment, which is just braces can be to create space and adjust alignment. That's it.